All right. Hello, everyone, and good morning. We're playing some Project Hospital today. If you haven't heard of it, it's a very in-depth version of building a hospital, hiring doctors, treating patients, and you can even control the doctors and tell them what to do step by step. I have played this like twice so far of building my own in Sandbox. I've had one successful hospital and one not so successful hospital. This is not an easy game. It just we're gonna try to start small, slowly build our way up, and hopefully don't run out of money. Because that's where you always go wrong, is when you run out of money and then you can't buy the resources you need to keep people alive. All right, so our first goal is to open an emergency clinic. Easy enough, right? Right. So if you go into emergency, it tells you basically everything you're gonna need is you need a waiting room, a doctor's office, a reception, and a cleaning closet, and a restroom. Now, like the green ones are like things you can do without in the beginning, but is recommended. But the red you need to have to function. Goodness, I got cats playing with my computer. Okay, it's been a while since I played. Uh, so we're gonna just build a small little hospital. Because I mean, you can paint and decorate and everything, of course. Um, what floor do we? I kind of want this pavement. All right. White tile seems very hospitally. You've been streaming Minecraft lately. Yeah, I've never actually played Minecraft. But I've watched playthroughs of it. I think if I were to play it, I'd probably do like one of those sky blocks because they seem interesting. All right, we need a door to get in. This mod pack has some cool mods for it. Yeah, which one are you doing? Right. So we're gonna need doctor's office first. How big does it talk? Okay. Needs to be at least 4x4. All the mods 8. Skyblocks are fun, yeah. Oh yeah, I think I've seen a little bit of that one. How do I? Aha, that's how you do it. All right. So if you click on it, it shows you what you're gonna need for this room. So we need an exam table. Disinfectant. How do you rotate with R? Put that right there. Is that yeah? And put this thing on it. Okay. Oh, we need a desk in here too. Okay. With a paper holder. Okay. Trash can. With whatever this thing is. So it's a pretty small room, but it has everything we need in it now, so it can be used. Okay. Next, we are gonna need a restroom. It doesn't need to be very big. Should, yeah. I just have it on pause right now until we get everything that we need figured out. Okay. I mean, I guess this area here will be like the waiting room. And like this, we can have like a reception here. Just normal benches. We must have started out with $90,000, I'm assuming. Or maybe 100. Put the little Q machine by the door, maybe. Okay. Here we need. I'm getting a bunch of texts from work right now, so I've just had to keep an eye. Sure, it's nothing important. And some juice. No, can't put juice down? Okay. Here, have a little cactus on your desk. Beautiful. Just that one cactus. It's like gonna be the only decoration I have in this whole thing, yeah? Alright, so what else do I need for my emergency? So, I mean, I can have a cleaning closet. I probably should. But I may just. Mandatory for janitors. How big does it gotta be? Yeah, I could put it like right there. See, I don't want to take up all the room because like we're gonna need things like X-ray and more doctor's offices. So I kind of want to try to leave it open. as much as I can. And I want to have like a corridor going back for when we need to expand. But, so I can just squeeze in a little door. Nope, wrong button, this one. So it needs a shelf and a bucket cart. Easy enough. And then you can have a sink too. I feel like that'd be helpful for a janitor. Okay. So we're gonna need a doctor, a nurse, and a janitor. And so like you see it's separated, so like you're gonna need one for day to begin with, but then if you want to be open 24 hours, you can also have it open a night shift. Now, since this is our very first doctor, we probably want someone really okay, this Linda Wilson looks like it's going to be your best. So it's they're separated by what they're good at, like diagnosis, general medicine, acute medicine, and some of them will have like specialties. So I'm going to hire this Linda Wilson. The hospital can now accept patients. Okay. Get a janitor. I find this janitor doesn't matter as much, so I'm going to hire the cheapest dude, Daniel. Hello, welcome. And for the staff, you're a receptionist, so I should try to get one with a receptionist. She so focused. You're deep into this game? Oh yeah, this game is good. Like I I came across it by chance and I'm just like, you know what? I need this game in my life. It's like perfect for me. You shouldn't. Okay, yeah, I'm gonna go you. Okay. So I think we can start now. Treat one patient per day at emergency is our goal right now. And I'm pretty sure when we complete goals, we get money for it. And then I think you can get grants when you want to open like a new department, so you get a little bit of money that way. But yeah, cute little clinic. See, works. It's what matters. I'm trying to plan. I think I want to have like another doctor's office here, maybe X-ray here, and then a quarter going back and a quarter going over. But yeah, so we click on our first patient, tells you like what their age is, occupation, and right now it says 6 hidden symptoms. So I have to wait until they have like an interview. So they ask questions like, "Hey, what's going on?" And that's how you figure out what their symptoms are and how to treat them. All right, so he is tired and he has a cough. So my doctor automatically is going to listen to his chest, and then I'm also going to tell him to do a physical examination and temperature. See if he has a temperature. And let's just hope this is something that we can take care of ourselves, since we only have a doctor here and nothing else. So there's a limit on how much we can do, diagnostic-wise. See, like, if you look here, it says blood draw, but I can't do a blood draw because I don't have the right equipment. And, like, I don't have, like, a blood lab. Oh, so he has a headache and fever as well. The doctor's like, all right, I'm gonna feel your lymph nodes. So that's like when they go here and they feel right here. What they're doing is they're trying to feel your lymph nodes to see if they're swollen, because swollen lymph nodes is a sign of infection. Because that's where your immune system works. Now we're looking at the nose and we're going to look at the mouth as well. And up here, if you look at the top, it gives you like a percentage chance of what it could be. So we haven't, oh, looking at the nose, now we have a 100% chance that it is sinusitis, which is just an inflammation of the sinuses. Which, you know, give him some antibiotics, he'll be great. Which is great. So our first patient was done pretty quick. All right. And if you look, you can watch them like they go. She's using the hand sanitizer after she threw away stuff in the bin, you know? Like, it's very realistic. All right, so Frank Anderson is now treated and he will go home, and then we'll go on to our next patient. And that's just kind of how it goes. Now, you can just, if you get a good doctor, you can just let them be. She would have been able to figure out what's wrong with this guy without my help. But there is sometimes when you'll get a notification being like, hey, this patient is too complicated for the level of your doctor. Do you want to take control? And if you do that, then you have a more likely chance of figuring out what's wrong with them. All right. So it says our objective is complete. We treated a patient and we got $20,000 for that. And now it's requesting that we open a radiology clinic, which I think is a great idea. So Frank Anderson is leaving, but I'm just going to pause because he may have a broken arm. So we're going to do this right now. X-ray room. Okay, it needs to be at least 5 by 5, but I think I'm going to make it a 6 by 5. Just give it an extra one. Or maybe a 6 by 6. It says it needs its own waiting room. So I'm just going to put that like along here. Oop. Waiting room should be full. I don't know why they can't use the same waiting room. But you see, like, there's a whole bunch of different radiology ones. Like, you get CT, MRI, cardiographs, sonographs, you know? So, but we're just going to start with X-ray because that's like the most common one. We need walls. Maybe I need to make it one smaller so I can fit the... How do I... It's one thing. I need to make it smaller. Can I make it smaller? I don't remember how to do that. Alright, I'll figure it out. No biggie. X-ray door. We are gonna need that. Okay, click on you. What do we need? So we're gonna need an X-ray, you know, pretty obvious. And then a desk for our doctor. We'll get her a little stool. Where does this supposed... Does this matter where this goes? Because I'll just put it right there. And an X-ray viewer. I'm pretty sure that's pretty much all we need. Give her some equipment just in case. She can have some files on her desk. Okay. Oop. Oh, I didn't mean to move you. Why did you? Okay, yeah. Okay, we're good. Okay. We're gonna try to move that door just down one. Here instead. I need like a remove. There we go. This one. Perfect. And then just do a little waiting room for. Okay. Just kind of like, when you first arrive, you gotta wait to be checked in, and then they'll send you down the hallway to where the X-ray is, and then you gotta wait outside the X-ray door. It's pretty normal. I may just put some chairs here because that's all it really needs. So just, aha, yes, okay. Throw that away. Throw that away. There you go. Okay. Radiology clinic needs a technologist. So, radiology, 42%, biochemistry, 300. Honestly, I probably might just get this person. 220. No, he's not bad priced. All right. And we got $30,000 for opening that clinic. I think I want to open another doctor's office because we don't have enough. Like, we have like 3 people in line up here and only 1 doctor. So before we press play again, I think I'm going to do that right quick. And we'll make this one like a student doctor, so they're not great at their job. What is the name of this hospital? I don't think it allows you to name it. The only way you name it is like when you save, you can give it a name. Um, but I mean, we can think of something to call it. I want another doctor's office. Boop, 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 boop. Can I like copy or Medic Nerd Mercy? I mean, it's not bad. It kind of has a good flow to it. Medic Nerd Mercy Hospital. I'm down with that. Oh, I was gonna have a hallway here. We'll figure it out later. That's the best. guess it's good that if I build them all separately, they will all look a little different. No, I don't want that one. I want the one on the ceiling because it takes up less room. Here we go. Hire another doctor. He doesn't need to be as great. So you're the cheapest? You have literally 0. I may go with Frank instead, so at least he has a little bit. Yeah, and if you look here, it shows kind of like what their level is. So yeah, at level 1, they got nothing. At level 2, they have a little bit and a specialty. And then at full 1, they have 2 specialties. Like this guy is specialized in acute medicine and don't judge me for not being able to say that word. Anesthesiology, like anesthetics, anesthetist. That's a word right there. All right. I feel like we need to paint the walls, but I'm not gonna worry about that right now. All right, let's get started. I kind of like the angle I had before. All right, what's our new patient? Patient has a fever and a sore throat. So let's look at his throat and take his temperature. And if you go like this, see, like I have 2 patients in at the moment. If I click him, and then I can switch between the files like this. This guy has a back pain, and for some reason this doctor is doing a chest auscultation. Not entirely sure why, but he's new. He's new. He'll get the hang of it. I told him to give him a physical exam and see what that shows. Right now, it's saying it's something wrong with his kidneys. So we should take a look at his blood pressure, because the kidneys help with that. Sore throat, nasal congestion, headache. This guy's got a cold. That's my guess. Oh, this guy has scoliosis, which is when the spine kind of does a zigzagging as blue. So we can send him for an x-ray. But what he really, if you hover over it, it says he needs exercise is the treatment for this, which is what my doctor prescribed along with some painkillers to help him with the pain. Okay, so this guy has either tonsillitis or, okay, bacterial tonsillitis or viral tonsillitis. Why is, okay. So he either needs antibiotics or rest. So let's figure that out. Open Medical Laboratories Clinic. So that's blood testing. So our next goal is blood test, which I think I'll put right by the x-ray. We'll see. We're still doing fine for money, so let's finish the day off and then we'll work on laboratories. Or maybe I need it for this guy. I may need it for this guy. To find out if it's bacterial or taunt. No clear diagnosis. Consider adding more diagnostic equipment, laboratories, or radiology rooms. This patient will leave soon. Okay? So this is just basically telling me I need microbial sampling. So I need to get whatever. I need the microbiology lab in order to figure out what's actually wrong with this guy so I can treat him. So that's our goal, I guess. There we go. So we can do... Ooh, okay, so we need at least a blood lab. And then you can get microbiology and histology. Alright, so let's start with the blood lab and see if that's enough. Okay, so if we go hallway this way, we need first foundation. Just gonna do a bloop. Oh, it doesn't need to be very big. Okay, that's nice. We're gonna need some doors. Oh, that's big. I don't need that big. Okay. And some more doors. I guess I should probably... Must have the big government contract to build a... Yeah, every time I complete one of my goals, they give me like $20,000 so that I can afford to keep building. At least in the beginning, it's that way. You say that, but it goes really quickly. Like, all this stuff is not cheap. Needs to be attached to a... Okay. Some glassware. Okay. Need a sink. You need a PC. Yeah, I know I needed stuff. But it's not showing up. Where's my... Just exit out of you for a second. Why aren't you showing up? I got everything I need. Okay. No. Game mode. Why isn't the pop-up showing up? looking at you for a bit, slowly working my way a bit. Alright, well, enjoy your morning. I appreciate you watching. Aha, there it is. I was in the wrong. Biochemistry, neurology. I don't think this dude needs to know. Yeesh. And we can have a little waiting room right here for him. Make it kind of nice. Open Medical Laboratories Clinic, $50,000 grant. Jeez. Oh yeah, and we're gonna do a common room because we don't have one for our staff yet. Nope. What about here? Okay. First of all, get some chairs. With a water dispenser. Just to be nice. I'm such a nice person. Yeah, I know it's not accessible. I haven't put in a door. Can you? Here we go. That works. So we got a little, basically a staff room so they can eat, wash their hands, and then have a place to store their stuff. Nothing special, but it's good to have. I could probably fit in like a little bathroom here, but I'm not quite sure what else I want to put out here, so I'm just gonna leave it as is for now. Alright. Now where'd that guy go? Was it him? Yes, I can send him for blood sampling now. So we should be able to figure out if it's viral or bacterial. Alright, and this guy is... Oh, he's going for an x-ray. So this will be the first time our x-ray is being used. So we can leave him be. No, wait, who's next? You're next? Okay. And so far all we know is she has a fever. Look at the guy on the x-ray. He's pretty cool. Okay, fever, headache, fatigue. So she either has influenza A or influenza B. Now, if you look, the treatment for both of these are antivirals. So, like, if you didn't have the blood testing yet, you could just give this person antivirals and they would still be fine because it's the treatment for both. But since we have it, we might as well do it because we get money for it. So, where's this guy? Oh, he's in the bathroom. So if you look, it shows which patient they're working on right now. So she has taken his blood, she's doing the test, and he will come out here and sit and wait until he has his results. And then he'll go back to his doctor and get his prescription, and then he'll go home. Yeah. And same like with the scoliosis, is like I could give them an x-ray, but since we already know what it is, it's not needed. So there's no need to do it. Insurance company can be contracted. Insurance company uninsured can be contracted to send patients. So when you do this, it's the insurance company responsible for them. So let's say you had like a really crappy insurance. And what it would do would be it would limit what hospitals you go to. And so this is kind of what it's saying is we are in a partnership with an insurance company, so they send their patients to us. It's a way for them to make money. It's a way for us to make money. It's like a beneficial agreement. So we can be like, yeah, that's our contracted. So we have two contracts with them. We have the uninsured and cheapo care, which is they want us to open a clinic at any specialized department, which there's a whole bunch of them. I'll go through them in a minute. And treat a bunch of patients. 10 patients per day, which we may not do today because it's already half over, but do in the future. All right. So if you look down here, this is all the different basically specialities that we can start with. So there's intensive care unit, so an ICU, general surgery, internal medicine, orthopedy, which is like broken bones, cardiology, which is the heart, neurology, brain, infectious disease, traumatology, and pathology. I find for a good one to start with is usually ortho because we already have an x-ray. The only thing with ortho is we will also usually need a surgery, which is kind of what happens when you go with these specialities. It's like when you go cardiology or you go ortho, or you go like there's a lot of things that can be taken care of medications. But when they're serious, you now have all these patients sent to us for this department, and if they turn out serious and you don't have surgery, then people start dying. So it's kind of like you need to do it all at once or not at all. Why did you get Why did you mess that up? No, no, no. But how do I change it? See, this is what happens when I don't pay attention. Insomnia. There you go. No thanks. Sleeping drugs. There you go. I fixed it. So your doctors make mistakes sometimes. It happens. You're going to lab. You're waiting. You're not done yet, really? Oh, you're probably waiting to go back to your doctor. I see. Oh, you're the doctor. I must have clicked you by accident. You have a leg contusion. So all he has is a bruise, basically. He came here. He thought his leg was broken. Turns out just a bruise. Dude's a baby. You do not need Or a bandage, yeah. Give him some numbing ointment. He'll be fine. Alright, so he is all done. You're waiting for your blood test to be done. But, I mean, basically you need antivirals, which... Okay, where are they? Aren't here for some reason? Maybe it's because... There is no clear... this guy still doesn't have any clear diagnosis. So for him, we're gonna need to get another lab. He is... we need a microbiology lab next, I guess. Which is like, okay, we can do if that's what's needed. Ooh, this one's a big one. Alright, so what do we need? PC first. And we need sink, some fancy glassware, microscope, fume hood. I don't think I've ever bought one of those before. That's kind of interesting. I like the red one more because it has a top on it. I wanna trying to find. It's always good to have the like thing that you squeeze and hand sanitizer comes out of it. And I don't know why it's not something you can get for every room. Huh. Anyway, I guess whatever. We need a new person for... I'm gonna get the cheap person. I don't know if I need another cleaning closet yet, so I may just wait. Just debating if I need another wet restroom yet, because I could probably fit one right here. I'm gonna, just in case. You never know. It's not gonna hurt to have another bathroom. Have a plant. And a poster. Sure. There's always random posters everywhere in hospitals. Okay, start this again. Let's try to get microbial sampling this time. We will eventually figure out what is wrong with this dude. How you doing? You're just waiting. How are you doing? Well, we figured out what type of tonsillitis she had. Anyway. Man, I used to drink Boost a lot because I'm not a big breakfast eater. And Boost were great because then I'd still kind of get a meal, you know? Uh, but then I had to stop when I found out my stomach is sensitive to dairy because I couldn't find any that were lactose free. But recently, Boost came out with lactose free ones, but they just do not taste the same. I don't know why. They're kind of gross. But I bought a bunch, so I gotta finish them up, but I'm probably not gonna. Probably not gonna buy them again. Marvel, bud. Lay down there, bud. Still working on this guy. I could put something here with a hallway going this way, because we're gonna obviously have more here. I'm just thinking, I may want to have, if I go over here, maybe more labs here, whatever unit we want to do here, and surgery here. And then, ooh, actually, this would be a good place for an elevator if I ever want to get a second floor. That would be a good place to put it because it's in kind of centralized. All right, so they need antibiotics. There you go, bud. Put you on oh, not this one. Antibiotics too. You got a fever. There you go. You're done. So bye. You're still waiting. We'll figure it out, bud. You're gonna have to spend so much money, or your insurances at least. Yeah, you're treated. You guys hurry up and bring in your next patients, because we've already dealt with these ones. Say bye-bye to this lady. She's done. There we go. Who's next? You already know what you got. Alright, we'll give him his No. No. You need antibiotics. Why can't you? Okay, yeah. That's fine. It's a wonder there isn't psychology. Maybe it's in. Anyway. Maybe it's in. Okay. Treat 10 patients per day, and we got a whole bunch of money for that. Sweet. We may have enough money to start up some. Marvel, you can't put your paws on my computer screen, bud. I know you want attention. You're just saying hello. He's like sitting behind. Marvel is my cat. He's sitting behind my screen and he's like taking his paws and putting them around the edge. So they're like kind of coming around. So all I see is his paws, and it's just like, oh my dear. Maybe we just do ICU. No, gen surgery would start with general surgery. Maybe. Haven't really done internal medicine before. I've done cardiology, I've done ortho. Haven't done neurology before either. That'd be kind of a cool one to do, maybe. I wonder what would be needed. Oh, we finally did it! Dude has bacterial tonsillitis. Sweet. That means he can go away. I think we're gonna finish this day out, and then during the night we may look into getting a specialized department and see what we need. Seems like a good plan. So right now this is all medical laboratories area. Kind of want to move my x-ray. So I have an area just for my x-ray. But for now it's fine. Because if we move that, we could have a couple more doctor's offices. Alright, dude is finally leaving. What does the hours go to, I wonder? I think it's pretty much... Alright, let's see what's wrong with this lady. Oh, she has chronic fatigue syndrome. Which apparently is just recommendations. Really? There's nothing... A condition of fatigue that cannot be explained by any underlying medical conditions. Well, that kind of sounds like a cop-out if I have never heard one before. Yeah, me too. Hi, Mom. How you doing? What, you have chronic fatigue syndrome? Is day shift over yet? Good, good. Some days? Yeah. Okay. You don't. Just go home. You're lucky you're getting numbing ointment from us for just a bruise. Like, come on. Alright. It's at the end of the day? Dad and you are at Digby Pines? Well, I hope you guys have a good time. You all have to tell me how the comedians are. Visiting hours. Clinic is open. Alright, clinic is closed for the day. Okay. Alright, so what do I need for neurology? Let's see. If I wanted to do neurology, I need a neurology office, waiting room, cleaning, and reception. I don't think that would be that bad. Set up a value. Chief doctor. I think I want to do neurology. We'll do go off for a swim and have fun. Sounds like golf? Yeah, I'm pretty sure they do have golf there. Yeah. Not that I think my parents will golf, but maybe in the past they would have. See, it says I need surgeons for neurology. So if I do okay. Maybe look at this. What do I need? Do these all need surgery as well? Pretty much, yeah. I could do an ICU. So that's where I think where people would come in via ambulance. Let's figure this out. I do want to do neurology, so let's figure it out. We're gonna need a whole bunch of foundation. Um, we're gonna put neurology here. And you know what? I'm just gonna do this the whole way. And probably surgery here as well. And then we're gonna have an elevator here to go up a floor to like cardiology when we get to that point. So first things first, wall it all in. I'd kind of want this to be blocked off so it's all in one spot. And then have like a hallway. So get some doors. Okay. So neurology office first. Oh, actually, it doesn't need to be that big. Let's do 5 by 5. We'll have the waiting room here. Actually, I'd probably do reception here and I only have one cleaning closet so far, so I probably should have a cleaning closet here. Cleaning closet. Restroom. Maybe a common room here. We'll see if it's... Okay. Start with this. Build some walls. No, I don't need a wall there. I need a wall here. Whoop. Some doors. Boop, boop. Okay, we're gonna have another door going outside, like right. I want that there. Right here. Okay. Now, right before we start this, just give me 1 second, guys.